Well, thank you again for everybody joining us today for the presentation by Respiratory Quality Services. Some of you joined us on Friday for the other presentation on the cough assist and suction unit. If you did not get a chance to view that and would like to, we can have that recording available to you. And today's presentation, like I said, will be recorded as well. And now I just want to introduce Dr. Greg Holt, and he and his crew are going to be presenting today on the use of the Trilogy in ALS. All right, go ahead, Greg.
All right, can everybody hear me? All right, my name is Dr. Greg Holt, Director of Operations with Respiratory Quality Services here in Houston, Texas. I am flipping the screen around. I'm joined today, if you guys can see this, because I can't. There you are. Jordan Placencia. Hello, Jordan. Education with RQS. And the warehouse manager, Carlos Moran, is going to be our virtual patient today. So we'll see how everyone does. We're going to talk about ventilation today in the home as if you were the patient being set up. So Jordan is going to be setting Carlos up on the Trilogy ventilator to support respiration, as if he's got some breathing problems, possibly shortness of breath. But however it works with ALS, when your respiratory muscles start to lose their ability to support ventilation, that's when you'll need one of these devices. So I'll send it now to Jordan, and he's going to step us through it.
Good morning, or good afternoon, actually. My name is Jordan. Again, I'm with Respiratory Quality Services. I've been a therapist for about 6 years. I started on Memorial Hermann, then moved my way to Methodist, and now y'all have me here. As you can see, this right here is our Trilogy ventilator. It's a Trilogy 100. As you can see, the name is right here. So this is basically how we show up to our patient's house, a typical setup. It'll be the Trilogy on a stand, and then I'm gonna lift this up a little bit, and then you're gonna see a heater right there. And that's gonna help you with humidification. So this is how the Trilogy looks. Here's your on and off switch. Here's your alarm silence button right here. Here's your, again, this is not touch screen, just if you were in the presentation of Friday, just as the other device, this is not a touchscreen device. So you will have to navigate through the system with this. So on this side right here, we have an SD card, and that's more for your clinician in case the doctor requires any data from you. Then the clinician will know what to do with this card. In the back of the Trilogy, we have our pollen filter. So this right here filters any big particles, pet hair, you name it, dust. So with that said, we always advise for this to be clean. At least once a day, check on it, make sure there's no dust accumulating. If there is, just wipe it down. And then once a week, just wash it with warm soapy water, let it air dry, and put it back in. This right here is an oxygen port. Most of our ALS patients do not require oxygen unless they have a pre-existing lung condition, as far as asthma or COPD or some other lung conditions. So, but with that said, there is times where in case of emergency in the ambulance, they like to place you on oxygen, and you're more comfortable on wearing your device than their device, they can plug in the oxygen here for you. This device is not only operated through electrical system, but it also has a battery for you. It has an internal battery, and then it has an external battery. Together, of course, depending on your settings and how much you use it and how much you adjust your alarms, both batteries can last you up to 6 hours. So this is detachable. As you can see, you can check how much charge it has. As you can see, this one is about 50%. Okay, so I'm gonna place it back in right here. Yeah. Okay. With that said, I hope you've been watching the news. There's some tropical storms right now approaching. So we always recommend our patients to have this device plugged in at all times, especially if we rely on it to sleep. You know, if you can't sleep without it, always plug it in. That way, in case of a power outage, and it's always charged for you. I'm gonna turn it around this way.
Now, if you're going to show us the screen, you're going to have to take it off the stand and put it right there.
So now I'm gonna remove it from the stand. Okay. I want you to focus on this little green light. This little green light right here means that the power is connected to the ventilator. If I was to remove it, it will go dark. So that's another way to know whether your machine is plugged in or not when the device is off. On this side is where you're gonna get all your air from, or your positive pressure from, okay? With that said, there's a bacterial filter that goes connected to it, and this is to filter any particles that you can see, and it can be harmful to your airway. So that's why we like to put this in here. So this is your filter. Here I'm gonna connect the tubing that goes to the device to your water chamber. This water chamber is where you're gonna fill up distilled water, and we always recommend distilled water. One reason being is so there's no calcification or any minerals deposits that can eventually make the therapy unpleasant, because you're gonna have, I always like to call it like a fish tank. It's gonna turn like an amber color, and just you will not stand the smell. With that said, we always also recommend to wash this once a week and let it sit there with a 50-50 of water and vinegar to get rid of all that smell. Now I'm gonna set it up on the chamber right here. Okay. This right here is gonna go connected to the patient. So here, filter, tubing to wire chamber, the other opening, that's where the tubing connects to, and then eventually connects to the mask. Okay. Remove this for you, because this doesn't need to be here. And it'll connect to the mask. All right, so for now, I'm just gonna go back to our screen before I connect this to Carlos. Mostrar la cosita. Okay. All right, so going back to the screen, I'm gonna turn the device on.
And Jordan, we had a quick question about a generator. Can you guys, let's see, provide any advice on generators to power the Trilogy in the event of an extended power outage?
We always recommend a natural, a generator that has natural gas source instead of, regular gas source, because if for any reason you place this floater, you cannot reach a gas station, and then you run out of fuel, then you're back to square one. So normally we recommend, planning time, plan ahead, see if you can evacuate to away from the storm. If for any reason you can't, I know right now the COVID-19 virus is very difficult, but we normally advise our patients to try to seek shelter at the nearest hospital or or a school. Sometimes the schools provide shelter and they do have backup generators. With that said, just plan ahead. You know, we're like right now, the storms, they're predicting that it's not going to hit Texas, but you know, it might change. So with that said, just plan ahead and always keep your device plugged in at all times. But if you are one of those that does have their regular power generator, regular gas generator, I would just say, just, you know, try to get as much cans available to you, 5-gallon cans. That's all I can say at this moment.
Thank you.
Yes, yes. Okay. So with that said, I'm gonna turn the device again. So this is your on and off switch. Okay. So this is normally how your screen will look. This lets you know there's an SD card inside the device. This little bolt is letting you know the device is being charged. And if I was to unplug the device, I'm gonna get an alarm. It's gonna tell me that the AC power has been disconnected. With that said, I'm going to address the alarm. Just click reset on it. And then you can see a little square around it. It's gonna tell you that the device is operating from the detachable battery first. Once this detachable battery is depleted, then it will move into the internal battery. With that said, let's say you were gonna change the battery, or you remove the battery. It's gonna tell you that now the detachable battery is disconnected. We'll click reset on it, and then it's running on the internal battery for you. Okay. Now I'm gonna plug in back the device. You're gonna see little volts come back. It's charging. I'm gonna flash the battery once again. And that's normal. It's gonna turn red like that. This is recognizing, the software recognizing the battery. And then boom, now they're both charging. Okay. The device is also Bluetooth available. That means that there's some instances we do have a hub that we can connect to the patient at the patient's home, and then we can review data remotely. We're not able to make any changes, but we are able to view some data from the patient. This Trilogy device, when it is prescribed to you, of course, is for due to some tests that they do, lung tests, and you qualify for it. So with that said, your pulmonologist has realized that you're not able to breathe on your as easy anymore. So the pulmonologist will prescribe 2 different settings. One that you're always going to be using during the day, during the night. But just in case, for any reason, you feel like that setting is not working enough for you anymore, the pulmonologist will prescribe a higher setting, and we all like to call that the rescue setting. So with that said, where you find that is going to be on the menu side. So I'm going to click on menu. Okay. Right here where it says switch to secondary settings. Okay. I'm going to go in there. And I'm going to click select. And that will switch to your rescue setting or to your exacerbation setting. However you want to call that setting, that is up to you, but we like to recommend it as a rescue setting. Okay, and I'm just going to go back and change it to primary. Select, and then click yes. Okay. For any reason, let's say you did those changes and you forget which setting you were on the top left of the screen, you can see where it says passive PC AVAPs, and it has number 1 in between. That's going to tell you that you're in preset 1. So when I switch it to secondary, right there, it's going to show you in preset 2. That's how you're going to differentiate with whether you're in your normal settings or the rescue setting. So select yes. Okay. Any questions so far? Am I moving too fast? No. Okay. Now,
We have a couple of questions in the
Go ahead.
chat, Jordan. One is from Jeff. Are there any best practices for maintaining the life of the breathing tube? And he said, we had an issue where the breathing tube became very pliant and the connection to the filter could twist shut during sleep.
the only thing I can say, just always as before you're gonna wear yourself, and make sure you try to have an extra backup tubing, and that whichever DME provider you have should be able to assist you with that. We like to advise our patients to clean the tubing at least once a week. Assess it when you're cleaning it where there's no holes. Replace your filters at least every 2 weeks or as needed. And a good way to check that is to remove the filter and make sure it's not turning gray. Because if it's turning gray, that means, of course, it's getting dirty. It depends on the usage. So let's say you use it for 8 hours a day. Your filter won't get as dirty as somebody who's using it 12, 18 hours a day. So always be aware of that. And always, let's say you have two tubings and you're about to use the last one, call your DME provider and say, you know what, I'm on my last one.
We had another question. Let's see. What is the power for sizing an inverter to use in the car with and without the humidifier?
You got me in that one.
We don't know.
Don't know. You got me
Okay.
down. We don't know that. I'm sorry about that.
But you shouldn't be using the humidifier in the car anyways when you're traveling with the Trilogy. If you're going with a Trilogy, it should be set up just like a portable ventilator without a water chamber, heated humidifier, because one thing you don't want to have is water going back into the ventilator.
Okay. And
in some cases, they can use, it depends on the kind of patient. You might use an HME or, one of those heat moisture exchangers, but generally you can use this without a face mask, tubing, and just a portable ventilator without the heated humidifier in a vehicle.
okay. And one more question. What's the difference between regular and passive settings?
So the one where it says passive, that's actually the type of tubing that we're using. So just that passive side, just to remind the patients, that's just the type of tubing that we're using. The difference between, if I'm understanding the question right, they're probably asking me between preset 1 and preset 2 maybe. It's just that one is gonna have, number one is gonna be the one setting that they're always gonna use the most. So it's gonna have the volume according to the ideal body weight, normal respiratory rate that we set. Now, the secondary one is gonna be a little bit more aimed to, alleviate any exacerbation that the patient might have. So it's gonna have higher tidal volumes, higher pressures, a little bit increased respiratory rate for them to help them blow out any excess of CO2 they might have. So that's the difference between them both. So don't let the little passive label throw you off on that, because that's just the type of tubing that we're using.
Okay, thank you.
All right. So now I'm going to move to Carlos. Okay. So one of the things that we always look at our patients, there's a lot of questions that I have had since I've been with our company. Patients come and they said, you know what, my family member has, why am I getting a full face, or why can I get a nasal mask? I tell them it all depends on the type of disease process that each person has. So unfortunately, most of our patients that get diagnosed with ALS can either start from the legs, from the feet up, or from the head down. So when our patients start from the feet up with the disease, it's a little bit easier to place them into a positive pressure device than a patient that is being started with the disease from the head down. Because of the bulbar side of the onset of the disease, it's a little hard to ventilate. So the patients that ask me and I already know they have their own bulbar onset of the disease, I always advise them that we're gonna have to set them up with a full face mask, not with a nasal piece, because they're not able to keep the airway closed like any of us can. So if they have excess salivation or they cannot close their airway, they're just gonna escape. And if they have excess salivation, it's gonna go everywhere, you know. So if you have anyone that tells you, I understand your concern, but for the type of onset of the disease that you have, we recommend the full face mask. There's two types: the one that covers your full face, and the one that just goes under like this. But now, for training purposes and for the show purposes, I'm gonna place Carlos in a full face mask, okay? Because that's the most common one that we like to use. So, as if you attended if you attended on Friday, you're always gonna see me, or that I like to place the mask on the nose bridge first, and then go down. That way I can find a good fit for it. And also, because you're protecting the front part of it. So I'm gonna go here. I'm gonna go here. Luckily for Carlos, I already pre-fit him with it. It's gonna be a little bit easier. Okay. Now, as you can see, this mask has a little hole right there. This is what attaches to this little elbow. And that is for patients that like to get up in the middle of the night and when it's a restroom, you don't have to take off the whole mask. They just take out this part of the attachment and they're ready to go. So now I'm gonna turn on the device for Carlos. So it's gonna have a little bit of pressure. Okay. So the mask this should be the correct filling of the mask. Turn to the left a little. Normally what I do, I'll ask him, is it too tight or is it leaking? Okay, so is it from the top or from the bottom? Top. So what I like to do, I just press a little bit, actually I'm gonna let go a little bit because it looks like it's a little too tight. Okay. How about now? Better. Okay. So again, just because you got fitted with the mask correctly that first time, that does not mean that while you're wearing the mask a couple of days, the mask might not leak, because again, it's rubber, so it tends to favor one side and the other. Just readjust. And I know it's a little bit different, somebody with ALS, but we always recommend their loved ones to ask them the questions. Okay, I put in the mask on you. How does it feel? Does it feel like it's leaking? If they say yes, then readjust it until the leak stops. If they say no, then just leave it, let it be. It'll be fine. Now, with that said, I don't know if you noticed, but he pointed that it was leaking on top. I not only adjusted the top, but I also adjusted the bottom a little bit and kind of pulled the mask out and pushed it back in. And that's because if you favor one side when you're adjusting the mask, let's say you just favor the front, it's gonna leak from the top of the bridge, the nose is gonna favor, the leak is gonna start leaking from the bottom. If you just focus on the bottom, the leak is gonna start coming more from the top. Okay, so it's very important that when you do readjust the mask, to adjust everything at the same time. Sometimes you have to undo all the straps and you just push it until they tell you it's not leaking anymore, or you don't hear any more leak. Then you can readjust it. Okay. Now, as far as removing the mask, I always tell my patients to take it out from each magnet, because this is magnets. And then instead of bringing the mask up, I always tell them to just reach behind them and just bring it up that way. That way, you're not dragging the mask all around your hair, and then and you're not damaging any of these components, because this is so delicate that it can tear. Sometimes I see where I've gone to patients' homes during a ventilator check, and this is cracked. They have taped it. I just like, you know what? I would kind of re-show them how to take out the mask. It's nothing wrong that they're doing. It's just that sometimes it's more comfortable to take it that way than instead of reaching behind them. So with that said, I always, you know, the loved ones be there right there to help them out. So I'm gonna place the mask back on Carlos. Okay. Now I'm gonna ask Carlos to act like he's breathing hard. Can you start breathing a little bit, like you're having issues breathing, like with your belly? There you go. So if you see a patient that's doing that a little bit faster, or one of your loved ones, you see that they're doing that faster, make sure you ask them, how's your breathing? Are you doing okay? They might tell you, you know what, I'm having a little issue breathing, and I'm gonna tell Dr. Holt to move this way. As I'm not breathing like I normally do, that's where your preset number 2 will come in play. I will go to menu, and then I will switch to secondary settings and just click select. It's gonna feel a little bit stronger, okay? Select, and then I will click yes. And then I will just exit. That right there is gonna give Carlos a little bit more of their help, okay, than what he's normally used to. So that will be our secondary or rescue setting. Now you might ask yourself, well, how do I know? I want to know the settings in case I'm in the hospital or the ambulance is telling me. 9 times out of 10, your therapist or your service provider can let you know. Okay. So lucky. So you normally will go to menu. Let's say you don't have those settings on hand, you go to menu, and now you go all the way down to information. Information will let you know which setting you're on at the time. Okay, so I'm gonna click select. So it will tell you in pressure control mode. And then you just read these numbers to the ER person or the EMS person, and they'll know what to do. Okay, or if you're at the hospital, they know what to do with those settings. They'll copy them down for you, and then let the physician know which settings you're on. Okay, so finish, and then just exit. Okay, so also another thing that we like our patients to know, to keep an eye on, is on the respiratory rate. We normally, the more they use it, the more the family member knows how fast they breathe. So I would say a normal respiratory rate varies on each people, but if you want to go by the book, 12 to 20 is a good number to go by. So right now, I have it set it at, on this setting, I have it set at 14. So I'm getting a respiratory at about 16 or 15, but that's just because we're moving the lung. But I'm gonna ask Carlos to finish. That's it. Come on. That's it. Okay. So I'm gonna ask Carlos, can you move the lung fast for me? So I'm gonna ask Carlos to go a little bit faster with the lung, like if he was being on distress. And the reason why I'm asking to do this is because I want you to look at this number, okay? So if the number goes to an outrageous number you have never seen, and then this The one that has a double R, it starts going on the 30s or 35s. And your loved one seems like he's struggling for air for, each time. That right there, as you know, that means he's in distress. He or she is in distress. And unfortunately, there's nothing that your DME provider can do at that time. So we always recommend you to, when that happens, and let's say you're already in your secondary setting, it's better for you to call 911. Don't wait for your therapist or for your DME company to contact you back. I will say just call 911, because at that point, that your loved one is needing additional help that we cannot provide at that time. Because we're mainly able to service you with ventilator, troubleshoot. Like something is wrong with the filter, a circuit leak, So, but now we're back to normal. So I'm just gonna let it be. Any questions so far?
Yes, we have a couple of questions. Let me scan back through the chat here. Let's see. I'm sorry if I miss anybody's questions, but can you use the Trilogy without the cords to humidify, or the Trilogy without the cords? They have failed to give us our cords.
Okay, so your Trilogy and your heater, I'm gonna turn this off for a minute. Okay. So your Trilogy and your heater have two separate cords. Okay. So unfortunately, the heater does not have a battery. So this one always has to be connected to power. Okay. The Trilogy, yes, you can use it without the cord. Okay, I'm gonna plug it and adjust it. You can use it.
Hear me? Good question.
Battery operated. Sorry about that. It's battery operated. So at this moment, it'll be running on the detachable battery. Just remember, it all depends on how much you use it. Okay. As far as the humidification, if you are using this as portable ventilator, you will not have this setup. You will only have the tubing coming from the device. Without the heater. Okay. Straight to the mask. So let's pretend this is Carlos for a second. So from the filter, tubing, and then to the mask. Okay. So I hope that answers your question.
Okay. We have another question. Peter's got his hand raised. Peter, you want to go ahead and ask your question?
Do you have any experience with users reporting sore throats when they use the Trilogy? Mine tends to give me a sore.
Mm-hmm.
That's it.
Okay, that's another question. Okay, yes, we have, and normally we tell them to make sure the heater is set at the right temperature. This heater right here, as you can see, it has 1 liter light. Okay, so the one light meaning is low. When it has two light meaning is medium. When it has three lights meaning is what's it called, high. So for now, I'm gonna let it press one time. See, now I have three lights. So this is at the highest setting. So my medium setting, and this is my low setting. So with that said, at first I will see which setting, and I'm sure you will be instructed. You might not have the same heater, so, but I will try to see which setting my heater is on and try to increase the temperature of that. If that does not help, that's just meaning that, let me see the math real quick. That might mean that you might need a chin strap, something that goes under your chin, because the mask, when it's like this, and everything is set up right, you're gonna get the humidification that you need. But let's say that I'm a breather myself, so if I was to open my mouth too much, this part of the mask will go in between my mouth, and that could cause also dryness in my throat. So I would just try to see somebody to maybe monitor you during the day while you're taking a nap, see the way you're sleeping during the day, see if any of these are the factors. So, but I'll first will go with the with your heater setting.
Okay.
Mhm.
You were mentioning before about cleaning it, the filter with water and vinegar, 50-50, is that what you said?
Not the filter, the tubing, or your tubing, okay,
Yeah.
and the canister. So you can do 50-50, you can do 2-to-1 ratio. So you just clean it. Normally I would I would put the vinegar and then the water, let it sit there for 10 minutes or so, rinse it out pretty good, and let it air dry. Same thing with your tubing. The filter right here, this one, the white one, this one after 2 weeks or so, it could be less, it could be more, depends on how dirty it gets, you just toss it away. The one that I was mentioning about washing once a week is the one behind your ventilator. Because even though you clean it out from here, you're cleaning it, dust might go inside. So you just want to rinse it out so all the dirt can come out. And then you just let it dry, you can just smush it.
Is that just a sponge?
Yeah, it's like a little sponge.
Open cell foam.
Uh-huh. So, and after, normally when we do our setup to our patients, we give them this one that comes in setup, and we give them issue two extra ones. So after 6 months, if it's coming apart, it's breaking, because this doesn't last forever. If it's breaking apart, just exchange it. Okay.
Okay.
Thank you. We've got a couple other questions. How do you order additional external batteries? Do you order online or from RQS or from another home care company?
Carlitos.
You can order them from us. We will be glad to sell them. Unfortunately, the Trilogy only comes with one, so any extra additional batteries will have to be purchased. I've seen them online in certain places, other DMEs that sell them. I've never seen them in Amazon or any of those places like that. But I will we'll definitely have them in stock if you're needing any.
Okay, thank you. Another one, can you please explain the mask that is preferred for bulbar onset patients?
Yes. So just from experience, I always prefer the full face masks, the ones that covers the top of the bridge of the nose, and then basically just like this one, exactly like this one. It doesn't have to be the same brand, but it was cover the nose and the whole mouth. Just because, again, they don't have enough support here, it's gonna come down. And then if they're already, I do have some patients that are claustrophobic, and I just got them to wear, one of these masks. And sometimes it's hard for them to wear the chin strap that I was talking about. The chin strap is basically a little band that goes from here and attach it to the top of your head to keep all these closed. They cannot tolerate that, so, I mean, I don't like this disease. This disease is very, very hard. But I always tell my patients, that at least do your best to wear it during the day. Don't wait at night, especially when you first get set up with the device. That way you can get used to the mask. Even if you're only wearing it 5 minutes, 10 minutes during the day, you're increasing your usage. So by the time you go to sleep, you feel more comfortable using it, especially when it's a full face mask like this, because nobody's used to a mask like this. And all of a sudden you got to wear it, it's a little hard. Now, like I said, it's another type of mask that just rests under your nose and covers your mouth. But even those, if your mouth opens, it's gonna pull that from the bottom of your nose, and then you're gonna start leaking again. So normally my preference is this type of mask.
And we had one from Elizabeth. Do your numbers change automatically when you change to higher settings?
Well, yes, like, so from the preset number 1, the preset 2, yes, because we already have those numbers preset for you. So I'm just gonna throw in a number there. For example, preset number 1 can have a tidal volume, I don't know, of 500 tidal volume, meaning what the amount of air you're gonna get in your lungs. That says 500, right? And you're ventilating on that for, I don't know, for 6-7 months. All of a sudden you become distressed. Then the secondary setting is gonna have a tidal volume of 600. You know, so that way you become in distress. You switch to secondary, and the numbers are gonna change automatically. You don't have to change anything yourself. We preset all that for you. Mhm.
One more. We have a person that says, I'm on CPAP now. Let's see. When do I need to switch to a Trilogy? Do you know if the pulmonologist or neurologist makes this decision?
It's normally a little bit of both. The neurologist will basically schedule a visit with your pulmonologist. That way the pulmonologist can send you to have some lung tests done. It can be it can be or at least a sleep study. So they can do it by sleep study, or they can do it by pulmonary function testing. So a little bit of both goes there. And depending on those numbers, because of insurance purposes, it's how they qualify you for a Trilogy. So let's say right now you will not qualify for a Trilogy. There's another type of machine that you can qualify for, and we can set you up with that. And eventually, as your disease advances a little bit more, depending on your numbers, we'll set you for a Trilogy. So it all depends on the values that you perform during your test. So a little bit of both goes there. Neurologist will contact your pulmonologist. And I always like to advise my patients if they do start having a lot of increased salivation, to get with the let the neurologist go so they can prescribe something to them for that. That way, what's it called? It's a little bit easier for us to go and set up that patient when we're doing any kind of positive pressure device setup.
Great, thank you. That's all the questions right now.
I got one.
Okay, Peter?
I got one, yeah. Most of the time when I'm on my Trilogy, the leak number hovers around 40. Is that okay?
So yes, and all. So a number that we like to see, and I'm glad you mentioned that because I was going to go next to the settings, to the values. But yes, so depending on the type of settings that you are, normally, the higher settings you are, of course, the more leak you're going to have, because the more air that's flowing through your lungs. So a normal number that I like to say is between 35 and 45. You're staying between there, you're great. Now, of course, if for example, for any reason your settings were increased, you're gonna get a higher leak. So it's more like I will say setting based, but right now your leak is a good range right now of 40. And the leak is basically for you. Ventilators is letting you exhale the CO2, because this ventilator only has one way to give you air and one way that there for you to exhale. And where you exhale, these little holes that you see right here. Okay, and that's where you exhale your CO2. So the ventilator is already programmed to compensate for that leak. That way you can exhale your CO2. Now, with that said, would always recommend to keep this side open. You might say, well, how do I do that? Some people like to sleep with the covers on. If you sleep with the covers on, you're basically not letting the CO2 get out of your lung. At least that's what the ventilator is telling you. So you're gonna get an alarm that's gonna tell you low leak circuit alarm. When that happens, if you ever see that alarm, I always advise my patients to look at this whole system, the little holes, and each mask is different. You might have the holes on the front. So just anywhere where you can see where there's a little hole inside the mask or the elbow, I would analyze it and make sure there's nothing covering it up. Because sometimes, one of the little limbs might get stuck, or it just is open. It's not closed all the way. I'm sorry about that. Closed all the way. And I have had that before where it says low leak alarm, and my leak was below like 40 or 35. And then by pressing this, we corrected that alarm.
Great, thank you.
That's it. So we're basically done with the setup.
I have-
Open to answer more questions.
Well,
I
then one more
have,
question.
I have a couple of questions. Number one, the inhalation hose that you show on your, that connects into your humidifier looks like a little Y piece between the hose and the humidifier.
Oh,
Mine's
this-
not set up that way. What is that for?
So I'm sorry, I forgot to mention this. So most of our tubing that we're non-invasive patients comes with a little water trap. So of course with humidification and the ambient air, there's condensation in the tubing. And with that said, water is gonna start building up. So if you ever have that water building up because the air inside the tubing is too hot, normally you can either by raising it, like raising all the way up, you can let the water drain back in and on one side or the other. And then you turn this little cap right here, and then there's a hole where the water will drain to. So that's basically what it is. It's just a water trap. That's what we call it.
Okay, well, that's not the piece I was talking about. There's another one not right next to the humidifier.
Which one?
A piece other than the hose. Well, I don't
You want
see
us
it off-
to trace the circuit so you can point it out? So put that back.
So I'm gonna put this back in.
Put that back on.
Put this back on here.
It's that piece that you just put on the table there.
This one?
The white piece. No, oh yeah, that's it right there.
Oh, this is
That's-
just part of the tubing that comes with. Some tubing comes with it, some don't.
Okay, I guess I've
That's
never
a
been,
elbow adapter. Mm-hmm.
never have been supplied with that kind of tubing. Okay, well, that was one question. The second question that I had was, well, let me come back to it. I had a suggestion for Peter. He was talking about his sore throat. When I first started, I was having problems with both my throat and the roof of my mouth. And first it was suggested I turn up the humidity, get more water, and that was very uncomfortable, and that didn't help. And then it was suggested I use something called Biotine and gargle about an ounce of that and wash my mouth with it before I go to bed. And that made all the difference in the world as far as the way my throat and mouth felt. So that's just a suggestion that worked for me, and it came from one of your employees.
Thank you, Jim.
It's Biotene, Biotine.
Biotene.
It's sold over the counter at the drugstore.
Excellent.
Oh, my other question was, you mentioned a gas generator. Are you talking about gasoline or natural gas?
Gasoline. Well, if you're gonna stay in town, natural gas generator, power generator, that's the only time I'll say, you know what, yes, your house is equipped for your breathing device. But if you have a gas, regular gas generator, like the one you get in the gas station, I will let you know, think twice before staying, because if the gas stations run out of gas, you're gonna run out of gas, you're gonna run out of power. Mm-hmm.
Okay.
Now, if for any reason it's a sunny day and all of a sudden your lights go out, I will not wait. I will call, and you pay your bill. I will call your light provider and then ask them if there's an outage. And if there is an outage, how long it's gonna stay, because again, you don't wanna be stuck without your device being powered all the way, charged all the way.
And also, it's always good to call your fire department and let them know that you have that condition, So if in case you need to evacuate, they usually put you on as priority if it does. They know your address and they know that you have that, ALS. So it's good for you to do that as well. It's something that I learned a long time ago when we went through Hurricane Ike, at my previous job, and that helped a lot of our patients get evacuated, prioritized.
Thank you.
And Peter has a question.
Yeah, back to the biotin suggestion. Do you add the biotin to the water reservoir, or how do you?
No, you just put an ounce in your mouth and wash your mouth out with it and gargle it in the back of your throat, and then spit it out. And I think the bottle says to do it for 45 seconds. And you spit it out and then use your usual setup. And with me, I found that my throat and the roof of my mouth stay comfortable through the night the next day.
Thank you.
All right. Well, that concludes my presentation. Again, unless anybody else has any more questions.
Let me check the chat. I think we've got
But I can't move it up or down.
all of the questions right now. If you do have a question, please feel free to put it in the chat. We can also ask you to unmute yourself and you can ask a question verbally if you have any. So we'll wait a minute.
Could we have a short explanation of how to change the humidity on the reservoir?
Yes.
I'm trying to, wait, it's all the way up.
Why don't you say what you just said?
Just be mindful that your reservoir might not be the same. Each one is a little different, but this particular one is a MR810. With this one, right now it's off. You will turn it on. It's gonna default to 3. Okay. If let's say that was too hot for you on high, you will just hit a button right here. You leave it pressed, and once it blinks, it's gonna turn down to medium, and then you press it one more time, and then it will go to low. And to get it back on high, you press it, and then it will go up back to high. Okay, so you gotta press it for about 3 seconds or so.
So Peter, remember, if your heated humidifier is different than this MR810 from Fisher and Paykel, to get with your respiratory therapist and they can explain it to you. Generally over the phone with a FaceTime call, since the pandemic is on, they can straighten a lot of this stuff on the phone.
Right. We have another question in the chat. Do you need to use the heat when you are using it? So I'm assuming she's saying when you're using the Trilogy device, you need to use the heat.
I will say yes, but again, it's all about patient comfort. There's some patients that they don't turn on this device at all. They keep it off, but they do put distilled water in their little water chamber, and they just like the coolness. There's other patients that like it all the way hot, and there's some other ones that like it low. So it's all about patient comfort, and that's what we teach your loved ones or the caregivers how to maneuver this depending on your comfort. Like for example, I had a patient that I set up a couple of weeks ago. I left the humidifier on low because she said medium was too high. I followed up with her the next day. I showed him how to change it to high because she said it was even medium wasn't doing it for her. So I said, well, let's put it on high. So she put it on high whenever to visit them for my weekly follow-up. Because that's what we do here. Once we set up a patient, we do a next day follow-up, and then we do a weekly follow-up. When I went to the house to reteach on the cough assist, on our device. She mentioned the heater again. So I advised to her, if you think having the heater off, because she eventually just turned it off. And she told me, I actually feel a little bit better having it off. I said, that's fine. That means you just like the cool mist. So again, it's patient preference. It's how you feel when you're getting that humidification. Just because it's not on, that does not mean you're not getting any humidification, as long as you have water in there.
And we've got another question. Can you wash the disposable filters if you are short on supplies?
No. Once these get damp, they're gonna stay away for a while, and then when you put it back on the ventilator, all you're gonna hear is a big old noise saying your pressure is high, and it's not gonna be pretty. So no, once it's that's what I always say. Try to keep like a little chart of your supply, so you know when you're getting low. That way you don't run into that situation. Yes.
Elizabeth, did you have a question? Yeah.
Do you need to have water in it at all times, even if you don't use it? And the heating, do you need to have water in it at all times?
Even if you don't use the humidifier, or even if you don't use it with the heat?
Either one. The heat, do you need
I would advise yes, just because I was explaining before. We don't want your airway to get dry, to get that sore throat, that dry throat. So I would water in there. And then if you, let's say, using the humidifier on high, you have it off or have it on low, I will say maybe after 4 days, just replace the water just to be safe. Not creating any bacteria.
When I use my machine, I've never had water in it.
Oh, well, again, that's your preference, and you're fine with it, and I don't see why change it.
Okay, no, but that's why I'm asking. If I don't have it on heat, is it better to have water in it?
If it's on, you should have water in it.
Yes.
If the heater humidifier is turned off, then
Mhm.
there can be water in it, or you don't have to have water in. But if it's turned on, then yes.
Okay, all right, thank you.
Thank
We
you.
have another question. Is it okay to bypass the humidifier altogether?
You can
Traveling.
for traveling, of course. A lot of patients that travel a lot, they bypass the humidifier all the time. And then at night, sometimes they do without it, or sometimes they put it back in the humidifier. So again, it's patient preference.
But we would rather you have the heated humidifier on to prevent some of the dryness of the airways that can cause some difficulties.
Okay. We have another question. We have an individual who uses the Trilogy 24/7, the cough assist many times daily, usually to get our very sticky clump of large mucus. This takes hours. I understand it is due to chronic respiratory failure, which can last over a long time in the last stages of ALS. Would a higher setting in Trilogy help to keep these clumps from happening?
Not really. Adequate humidification and hydration to make sure that you're taking in enough fluids. You want to make sure your airways are hydrated so you can produce secretions that can be cleared. And that means drinking water or using a PEG tube to have more fluid intake, to have the secretions so where they won't become so thick and sticky. It'll make it easier to bring up. But using the cough assist device during the day is a good thing. Have that suction handy. But just to say, turning up the volumes on the Trilogy or the other pressure settings can't suggest that you're going to stop having thick, sticky mucus. But adequate hydration is an important part of it. And using the heated humidifier, as you should, is also important.
Yeah. We have another question from Mike. He says, I need the straps tight to avoid leaks, but in the morning it feels like my teeth and jaw have become misaligned. Any ideas?
So, I mean, that just tells me that the mask is too tight. So with that said, I will always recommend, not with this type of mask that I show you, but most of the masks to be wiped down after every use, just so you can get any body oils, because that's probably what's happening. Maybe the rubber or the silicone has hardened around the mask, so he's not able to create a good seal anymore. And that's probably why he's having to tighten his mask more. So I will say just make sure you're at least replacing the cushion, that's called a cushion, once a month. But just keep washing it after every use. That way you're not over time the mask.
And to tell the respiratory therapist your issues that you're having, because all of these companies making masks, they make a triangle a different way, and somebody's medium might be another type of medium mask. But try a different mask if you need to, so you don't have to pull it so tight to get it to seal. You should always be able to pull the mask away from your face like a 1/4 inch or so, and not have it too tight, so you can adjust all of the parts of the headgear and everything to make sure that it's adequately tight, but not over tight. And it can cause pain and discomfort of the jaw, teeth, and leave those marks on your skin. It can even cause tissue erosion over time if the mask is on too tight. So get the RT to check things out.
Also make sure you're clean shaved, because if you're not clean shaved, then that also can cause leaks.
Great. And again, just a reminder, if you do have any questions, you can feel free to use the chat. Excuse me, or you can unmute yourself and we'll take a question that way as well. So want to give another minute to make sure that everybody has their questions answered. And again, I'll just remind everybody while we're waiting that this is being recorded, and we can make this available to you all if there's bits of information that you wanted to review again. And Dr. Holt has made himself available too. If you need to discuss your situation specifically, we can connect you to RQS directly. So, yeah, I don't see any other questions in the chat. Any other questions? Anybody want to unmute themselves and ask a question?
Well, Steve, I appreciate you bringing us on. Does somebody have a question?
We may have somebody.
This is Alberto. It's not a question. I just was watching, looking for the information on the manual, and it says 120 volts, 2.1 amps. So it should be, if you were like me, looking to have an inverter in your car that can power the Trilogy, something in the 300 watts should be enough. And if you can go a little higher, 500 or more, even better, but at a minimum of 300 watts, I would say.
Thank you, Alberto.
Thank you.
All right, any other questions? We have a lot of great comments from everybody. Very thankful for the information. Very helpful to hear other people's experiences as well and learn from other people. Let's see. Okay. Looks like that's all the questions right now.
All right. Remember, anytime, Steve, if they have questions, if they want to send them to you or send them to us directly, we'd be happy to answer them. You know, it's not easy out there, so everybody stay safe. Everybody keep an eye on the weather. you keep in mind, you know, that you need a place to go. So have a plan, keep your batteries charged up, and then, you know, everybody stay safe. Thank you so much, Steve.
Great. Thank you, Dr. Holt and Jordan and Carlos. We appreciate you guys so much. So that'll
thank you,
end our
Steve.
presentation, and we'll make this recording available to you guys probably in the next few days.
Thank you.
Thank you,
Thank
guys.
you.